Welcome to Cups and Courage, the podcast. Our next guest is Juliet. Juliet was diagnosed with breast cancer in 2016. She had a lumpectomy followed by a single mastectomy where she remained flat on one side, and 18 months later, she had the other breast removed for symmetry. Cups and Courage, the podcast. Welcome, Juliet.
Thank you. It's really nice to be here.
Thank you for being with us this morning. As a tradition on Cups and Courage, we ask our guests to bring in their favourite biscuit.
Okay.
And Juliet, you've brought Rory.
I have brought Rory.
We can't ignore.
He's going to be in the camera shot, I think.
That's absolutely fine. More than welcome. Cool. More than welcome. But I know that your biscuits of choice are sitting in the Cups and Courage.
They are indeed.
Biscuit tin. So here we go. I don't know what these are.
It's the suspense.
Oh. I don't know if are they fig?
Fig rolls.
They're fig rolls.
Look at those. Retro.
Also, not massively crunchy.
No.
Which is
crunchy.
Great.
Yeah.
So I don't know if that was I don't know if you thought that through. But
I just love these things. I don't eat them much anymore, but I will devour the whole packet if I do, so steady. And I've got a particular way of eating them as well, which I'm not going to demonstrate, but I chew the sides off first.
You're not going to do that today, are you? No. Well, you're welcome to as well, so it's safe space. Great. The other thing we always start with as well, we say, what's your definition of courage? And so that's not an easy question. We go right in.
Okay, well, who knows what courage is? I think everybody's got their own definition of courage. But I guess for me, it is just putting your best foot forward as much as you can every day. And whether that's just lying on the sofa or going out and doing something like chucking yourself out of a plane, whatever works for you, to me, that's courage.
Just keeping going.
Yeah, keeping on going.
Yeah. Juliet, I would love if you could give us a little overview. Mm-hmm. And it's always, when I say this, I'm mindful that this is 10 years.
Yeah.
Okay, so it's coming up to 10 years since your initial diagnosis, and a lot's happened.
Yes.
And we could sit here for 2 weeks and we still probably would only be,
Yep.
So give it your best shot if you can condense that.
Yeah, I'll try. So it's a simple story, to be honest. It just took quite a long time. So 10 years ago in January 2016, I was diagnosed with breast cancer in my left breast after a routine mammogram. And I had no idea that I had anything. There was no lumps or signs that I could see. So I had a lumpectomy, first of all, and they couldn't get clear margins during that surgery. So I then had to have a single mastectomy, my left one, which really traumatized me, actually, the whole thought of it. Then they told me I needed chemo, and I also had to have a year's worth of injections of Herceptin, which, because my tumour was HER2 positive as well as ER positive, so estrogen positive as well. I had the mastectomy. I did ask if I could have both breasts removed because I had really large breasts. They were 34 double G. My surgeon just said, no, ask me again. So I thought, okay, well, I'll just get the cancer gone. Had the mastectomy, 4 rounds of chemo, which was tough, but, it was doable. And then I had injections every 3 weeks. So that was my active treatment, which was really tough, but I think I did get off lightly compared to some other people, although I do feel like comparison is really unhelpful because everybody's tumour is different, everybody's treatment is different. So I took my surgeon at his word and I asked him again if I could have the second breast removed because I wanted to be symmetrical. It was really hard living with one huge breast. I had to have a prosthesis, which was massive, heavy, just really horrible. And he continually said, no, we don't remove healthy breast tissue.
So he had said then initially, ask me later.
I think that was to shut me up.
Just kick it along down the line a bit, right?
I think that may have been to shut me up and appease me, yeah.
And then then you go back, what's that time frame in terms of?
I think probably, the second checkup that I had with him after the mastectomy.
Yeah.
I thought I wasn't going to, push straight away, but I did ask him, I guess probably 3 months after the mastectomy, once it had healed and I had not got used to living with one breast, I then asked again, and it was just the same. No, we don't do that. My breast care nurse was more sympathetic, and she was, I get why you're saying that. I understand. I'm not sure why that wouldn't happen. We've never been asked that in this clinic before, which I found quite.
So they'd never
surprising.
been asked.
No.
So, for symmetrizing surgery?
No.
Okay.
No. And they assumed I would have reconstruction, which I decided against. So after 18 months, or 15 months, I'd say, of asking my breast surgeon, every time I saw him for checkups, I kind of thought, well, how am I going to do this? Because he obviously is not responding to what I'm saying. So I basically just, after he'd examined me, when I still had my top off, I sat on the side of the bed and kind of looked at him and said, why do you think I want to live like this, just with that one breast? And he kind of had a look and went, oh, yeah, okay. Let's get the diary out.
So you had to sit there?
Basically, yes.
And
give him a visual cue, basically, yeah. So, and he got his diary out and booked me in, which I was happy about, obviously, but I wasn't happy about how I had to go about it. So I had the second mastectomy. It was about 18 months after the first one. And instead of waking up feeling traumatized and like, oh, this is horrendous, I woke up with relief, when I looked down and was flat because I wanted to be symmetrical. That's all I wanted, and it was a good feeling at that point. Yeah.
And fast forward, here we are today.
Yes, here we are today, nearly 10 years later.
I can't get my head around how much of a fight you've had.
I know.
For Symmetry.
Yeah. I'm not alone in that.
Yeah, I know.
Plenty of women don't want reconstruction and don't want to just have one breast, and I think the medical profession just can't, or most of the medical profession don't seem to be able to understand that not all women want to be put back together as they were.
Yeah.
And it's individual choice, and it should be joint decision making with your healthcare professionals and informed decision making.
Well, let's go back. When you first found out that you needed a mastectomy, a single mastectomy, was there any part of you that was considering reconstruction, or were you just get it out, get rid of it, just get rid?
No, I did consider reconstruction because it was proposed to me. I had no idea about any of this. I didn't know anyone that had breast cancer. And when I was in the meeting that I was told I would have a mastectomy, they then went straight to, but we will reconstruct you using your own flesh, your own tissue, the DIEP flap, which is where they take tissue from your abdomen and put it onto your chest to make a breast mound. Now that's great. It's brilliant, brilliant innovation, and medical people can do that. And lots of people want that, and fine, that's great. That's their choice. So I said yes. And I did meet with a plastic surgeon.
Yeah.
And then I thought about it and I thought, no, I don't want to have it. It's too long. It's too big an operation. It's too long an operation. It's probably more than one operation to balance me up. So I decided against it.
What was not reconstructing presented to you in that initial place? Interesting.
Not at all, never. Okay. They showed lots of images to me, photos of women after they'd had the mastectomy. So they had one flat side, because these were people that were reconstructed, not immediate reconstruction. So just flat on one side. And then after they'd had their reconstruction, but nowhere in that lineup was somebody who had decided to stay flat and wanted both removed at all. No, it wasn't an option. And okay, maybe I was naive or I wasn't thinking. I'm not trying to go be down on myself, but it never occurred to me to ask for it.
Well, if you don't see it as well, and the people that you're putting your trust in, especially at a really vulnerable time, are not presenting that as an option.
No, exactly.
I can see why.
Yeah, and I think I was quite keen to go along with them because they know it. They know, it's like that whole God thing. They know what's right. They are the professionals. If they're saying that it would be good for me to have, reconstruction, then I'll do that. But I did think about it and I decided against. And I'm really glad for me that I did. I only managed it though by Googling, does everybody have breast reconstruction?
Okay.
And it came up that no, actually there's loads of people out there that don't. And in fact, I think the stat was, and I don't know how long ago it was, but only a third of people having mastectomy actually reconstruct.
That's interesting.
Yeah.
Because we hear varying degrees depending on who you are and what their lived experience is. But I would be interested. I mean, the data will be out there. Right? We could find
it is there.
to understand, what proportion of people actually choose reconstruction versus not. Or I know it's probably a bit more complicated because there will be some people who initially reconstruct and then explant, or delayed and immediate.
Exactly. I suppose the statistic is an easy thing to throw around. I guess what I'm trying to say by that is that you don't generally see or hear of people that decide against and who just stay flat, or they stay with one breast, and I think what I try to do through advocacy and doing lots of podcasts, doing lots of photo shoots, was to try and raise the visibility of what it's like to be flat, and it's not scary because I thought it might be, but it isn't, but people just don't see it on the whole. You don't tend to see many women and men who've had 2 mastectomies and they just got their scars,
and also living life well,
absolutely,
contentedly,
definitely
in that
space. And I do understand that there are people who are flat not through their choice. They can't have reconstruction for whatever reason, and that's really must be very difficult for them, and I really feel for them, but there are an awful lot of people who choose.
Thank you for saying that, because I think sometimes we forget that we and it's not binary. It's not I want to be flat or I don't want to be flat, or I want to reconstruct and not reconstruct. There's so much nuance, and some people can't for different reasons, and we don't touch upon that.
No, we don't really. It's not really talked about. It's all about us, advocates for flatness who are out there proud,
empowered, and
loving it and taking their tops off and everything. But there are people who are unhappy with their bodies being flat, and I think it is important to acknowledge that as well.
So you've gone to your surgeon and you've said, actually, I've considered this and I don't want to reconstruct. I would like to remove the breast. What was that conversation? How did that go?
It was very quick.
Okay.
It was, we can't do immediate reconstruction anyway, because you're going to have radiotherapy. I didn't have radiotherapy in the end, but I was very glad that I couldn't have immediate reconstruction, because it gave me the time to kind of work out what I wanted. But it was a quick conversation. I would like you to remove both breasts in that one surgery, to which the answer was no. Speak to me later. Or ask me later. And at the time I was like, well, okay, I just want to get the cancer out of my body, so let's focus on that. Focus on having the one breast removed. And he threw me a little bit of a dog biscuit, I guess, by saying, ask me later. Yeah. And so that kind of mollified me, I suppose, a bit, which is what he wanted. So,
And now you've had 18 months of living with one breast, one big not breast, one big breast. Okay, so were there any, I don't think I've asked you this before, were there any was there a physical impact? Because what I hear is there was an emotional and impact in terms of this symmetry. What was the physical impact with someone with 34 double G?
Double G.
Yeah, they're big boobs.
Big boobs. Yeah. And I'm only 5'2".
Okay.
So
proportionately big boobs.
The physical side was really difficult, actually, because I'm quite an active person. I like running, I like going to the gym, I like walking, I like being around. And obviously with two breasts, I had to strap them in. When I had one breast, I still had to wear a bra, because I felt that I had to support the right breast. Otherwise, it would have been smashing against my knees all the time or whatever, droopy.
Yeah.
So yeah, I had to find the biggest prosthesis that I could that would kind of match. However, they don't make bras big enough to fit into the pocket. You can't fit a really large prosthesis into the pocket of the bra. And so, it physically it was heavy. Like when it's your own breasts, it's attached to you. You are used to it, and it flows with you. It moves with you, and whatever you're doing, even though it's big. When you've got a prosthesis, it's like a dead weight. They're silicone, so they are, But this one was really heavy. And you put it in the bra. It's just like, no, this is horrible. And when it was hot, it was very sweaty. So yes, and because the prosthesis poked out of the pocket, I couldn't necessarily wear the tops that I wanted to because I wasn't happy with the prosthesis sticking out.
Also, I've not thought about this really before, but obviously there's no cleavage with the prosthesis.
There's no cleavage, no.
So actually, the type of top that you're wearing, although there is a breast form, if there's anything that comes down and with big boobs, there's a cleavage.
There is, definitely.
And so.
And
interesting.
Obviously I don't have a cleavage now, but it's fine because I wear what I want. If I want to wear a tight top, that's great.
Yeah.
If I want to wear something baggy and flouncy, then that's great. But we're having one breast and one prosthesis, it was just really hard. And for me, when I took off my bra at night, which was lovely, or when I got in the house, thud, the prosthesis drops on the floor, because I don't take it out in the bra. When I looked in the mirror, I really didn't like what I saw. It felt very, it was just horrible. I kind of gradually realised that the scar side was much more appealing to me. Appealing, that's the wrong word, but I liked that side rather than this huge lump of flesh, because that's really what it was to me at that point.
Yeah, and actually, I think if you've got cancer in one side, there is always this awareness of, I hope I don't get it in the other side. And so if there's an attachment to the breast that actually was, trying to kill you, there's almost going, well, let's get rid of that one as well, so we can, Well, did that come? Do you think that came into it?
Didn't really come into it for me because. My oncologist and the surgeon had kind of said that it's very, very, very unlikely to occur in the other breast. And I was really, really focused on symmetry. And I thought that was my main chance of getting that second.
Well, especially if they're saying, statistically, it is a very low risk. They can't measure your, No,
so you have to go for symmetry, which, is a very, I think, strong argument.
Absolutely.
So, that breast didn't mean anything to me anymore. I didn't have a choice of the left breast having that removed, but I felt that I had the choice to remove the second breast, and that is quite empowering. If you choose to remove a body part, because for your mental health, for your confidence, for the way you move, for so many reasons. That is empowering.
Tell me about your family, and and I love that your face lights up when we talk about family, because I know it's such a huge
incredibly
part.
Important to
me. Do you have a husband?
Got a husband, Liam.
Yes. And let's talk about what was going on for Liam. And what,
it was an interesting time. Just after so Liam knew that he had a heart problem. It was congenital, and it was actually discovered by my son Dan, who at that point was a student doctor. He was practicing his stethoscope technique, and with all of us, and he did it on his dad, and he went, okay, think you better go see your doctor, Dad. So basically, he was diagnosed with dilated aorta and a constricted aortic valve, and it was congenital, so he was born with that. But it only started really affecting him when he was like early 50s. So he knew he was probably going to have an operation, And after I got diagnosed with breast cancer in the January, he had another one of his scans which showed that the aorta had dilated to such an extent that he needed to have the operation. So sort of between January and May 2016, I was having mastectomy, chemotherapy, and he was having open heart surgery. He had a new aortic valve and a transplant of his aorta, well, part of his aorta, and a bypass. And the day that I had my first chemotherapy, he was discharged from hospital. And so my son, Dan, went to pick him up in London, dropped him at home, then came to pick me up from my chemo, and then went, I'll stay with you at the weekend if you like, Mum and Dad. You might need looking after.
Wow.
So yeah, but we are both fit and well and healthy. And nearly 10 years on, we both feel very lucky. And we try to, live our lives that way. It's not always easy. It doesn't always happen, but we try to. And I think next year we will try and have a bit of a celebration of life, because it was an incredibly tough time.
Yeah. And if you think it's a decade,
Yeah.
Yeah.
Yeah, so it's very hard. He was very supportive with all my decision making.
Okay.
He was like, whatever you want to do, that's fine.
How important do you think that is? If we're talking about
massive,
somebody's journey, to have that level of support and acceptance of.
I think it means everything, really, from your life partner, whether it's a husband or whatever, whatever. But because, if that person is not in agreement with you, then I can't imagine that. I think it might. I'm trying to put myself in other people's shoes, which I can't really do. But for me, I think if he hadn't been so supportive and just in agreement, it might have quite kind of destroyed the relationship, actually. Because, I try and support what he wants. I'd give him my opinion, but then if he doesn't like my opinion, he'll tell me, and we reach something together. It's ultimately his decision. I think if he hadn't wanted me to do that, that would have been very hard.
Yeah, I wonder what it's like for people, as you say, with their life partner who maybe has a really strong opinion about, let's say aesthetically, what someone should or shouldn't do with their body.
Yeah.
It puts the person going through it in quite a compromised space, right? Do they either choose what they want to do, what's right for them, or potentially what is right for their partner?
Absolutely. Yeah, I know.
And you would hope that everybody has those supportive relationships, and actually what's right for one person is.
Yeah.
But it's not always the case.
It's not always the case, no. And again, I was fortunate. My kids were brilliant. They were nearly 18 and sort of 21 at the time. So, interesting times in their lives.
Yeah.
Laura was doing her A-levels and Dan was finishing off his medical degree. He was due to get his results, I think, just before I was diagnosed. So, I was diagnosed, but he hadn't got his finals results. So I didn't want to tell him before he got his results. And Laura was doing her A-levels and she looked after us a lot.
Yeah.
So it was, it was interesting for them. I think it has really affected Laura, actually. She told me that she gets some kind of like panic when she has to go into a hospital.
Oh, does she?
Whether it's for her or her partner or whatever, she doesn't like it. She gets bad feelings. But they were brilliant. My mum was fine once I explained to her. She was not, I don't know why you would do that, Juliet, but...
Okay. So hang on, she was like that or she wasn't?
She was like
initially,
that at first.
Right.
But then, I explained to her why I'd come to that decision, and she was fine. She was absolutely on board. My sisters, my whole extended family, my friends, not one person really was like, well, what's, apart from my mum, well, what are you doing that for, No. So, everyone was very, very supportive.
So I'm just resetting, so you're going to have to edit this out. The feelings that you have towards your consultant now, because obviously we're in the system for a little while, aren't we? Okay, so we have this team of people. So now you've had this surgery done and you're living your best life, But you're living how you wanted to live. What's the relationship like now or after. with the consultant and the surgeon?
I just tried to keep it very neutral.
Okay.
You know, I suppose when I was trying to persuade him, I didn't want to annoy him as well, because I really wanted him on board. That's quite difficult sometimes. Once he had agreed, I was like, yes, excellent. You know, let's get this done. And afterwards, I didn't see him that often because, you know, it wasn't a difficult operation. It's quite straightforward. I healed very well. I had a couple of checkups with him. Then I was still seen by oncologists, much less often by a surgeon, for 5 years after diagnosis. So I haven't seen them.
Do you think that's what the fight is part of the reason why you took to doing some advocacy around visibility?
Definitely.
Do you think so?
Definitely, because I had never seen anybody with one breast or no breasts. I just had no idea what that looked like. I was like quite scared. Thought, well, what would it be like to see a woman with no breast, no nipples? You know, it's really odd. I didn't really know what to expect. So once I'd found that there are a lot of people, you know, like for instance, Flat Friends, all the advocacy groups in America, you know, they are very much more strident, I would say. Maybe that's the wrong word, but much more visible, much more sort of campaigning publicly, I suppose, rather than Flat Friends. And Flat Friends do a good job with what they're doing as well. You know, they do great
so
work.
Flat Friends are a community, online community, but also they get together in person, and they are raising awareness of the choice to go flat, remain flat, aesthetic flat closure after mastectomies.
Yeah. So I thought that I would really want to somehow get the message out that informed decision making is really important. At the same time, kind of raise the visibility and representation of women with one or no breasts, flat. And I did that in a number of ways. I got lucky, I think. I started blogging. I've got a friend who is a photographer, and she asked me if I would like her to take some photos of me flat. I said, yeah, that would be brilliant. Thank you. Yeah, fantastic. And I was thinking, maybe I can use those photos to go with my blog. And we did the photo shoot. Photos they're great. I really like them. And I started blogging. And that was the first time I'd kind of announced it. I'd said on Facebook or wherever, my blog, that I was flat. They were all with top off. So, and the response I got was incredible. Like people I didn't know, lots of my friends, people I hadn't spoken to for a long time were all, whoa, this is amazing, great work. We had no idea, And so from the blog, I then started posting more on Instagram with my topless photos. I did some articles for the Huffington Post, which I don't think exists anymore. But I then got in touch with other photographers. Behind the Scars is a brilliant project run by a woman called Sophie Mayan, who doesn't do photography anymore, but she wanted to take photos of scars, wherever they were, however they came about. So Sophie Mayan, who had previously taken some pictures, put a few of my images that she'd taken forward to Dove for a big campaign that they were planning called, what's it called? Show Us, #ShowUs. Basically, it was normal women living their normal lives, but with differences, all sorts of differences, colour, ethnicity, sexual preference, disability, lots of different things. And one of my images was, they wanted to use it as a global image.
It was this one, wasn't it?
Yes.
Was it that one?
It was me lying on my back, on my bed, with my hands like this, and obviously no top on. It was amazing. So it ended.
You did, honestly. I remember seeing that, and I don't know how early it was into my journey as it was. I think it was actually because I was diagnosed. You were diagnosed in 2016, and I was diagnosed in 2018, end of 2018, and so I think I had gone flat. Yeah. But you were the first person I saw on that scale.
Okay.
And I was like, whoa.
Well, that's what I wanted.
Yeah, but
that's what I wanted. Anyway, this poster ended up in Times Square on a huge billboard up there, a Piccadilly Circus, which I saw, which was amazing. Like on that iconic, massive thing, billboard, tube tunnels, escalators, stations. I don't know, advertising boards everywhere in London, all over the world, actually. It was very surreal, but amazing. It was great. I liked it because I liked seeing me. That was part of it. But the main thing was I really liked the idea that someone might be walking through a tube station through London, kind of look up, see something and go, oh, okay.
That's the thing.
That's, that's somebody, who has got no breasts. Wonder why. That looks okay. That looks good. I might tell my sister who's
look
got
what
breast
I've
cancer,
seen.
and it's all right. There are people out there who are living flat and it looks good, and I got I did get a lot of messages to that, to say that had happened to people, which is really amazing. I also went on Woman's Hour, can you believe that? Radio 5 a few times, talking about choices, talking about informed decision making, and that everybody has their own choices to make, and everybody's choice is respected. And someone wants to reconstruction, good on them, great, go for it, because that's fantastic. And I hope that you have made that decision with your healthcare professional and they have presented everything to you, all your options. So that's what I was working on. I just wanted, it's visibility, representation, informed decision making. It looks fine. It is fine. It's a good way to live.
This is really interesting because it's a large part of why I wanted to create space for these conversations, because like you, different, but there's a lot of similar themes that run through around the need to advocate for self, and that informed decision making, and the importance of patient voice and patient choice. And actually, we've spoken about this at length, but I've had a primary and 2 recurrences, and every single time it was self-found, and all throughout it, I have had to advocate for myself and my own choices. And actually, after everything, I realised I wasn't alone. There were so many of us who were having these similar experiences of having to really stand firm in the face of, someone who is,
pushing back
a little bit. And so I wanted to create a space where we could talk about these things, so people knew that they weren't on their own.
No. And also I think it's really important for people like you and I who feel able and have the ability, whatever reason that is, to advocate for ourselves, to find out the information, and then to be able to voice our views and our choices, because there are many people, for whatever reason it is, who can't do that and don't want to do that. And so perhaps by us and others, many others, advocating in lots of different spheres of medicine and cancer and other illnesses, perhaps they can see that it's possible and take some kind of not inspiration, but just
it is.
Some kind of, okay, I can do this. Maybe I can have a go and actually
inspire change.
Because it's not easy always to do.
And I also think it's the importance of respecting other people's choices, because yours and I's journey hasn't been the same. Our choices haven't been the same throughout, and our ultimatums haven't been the same. And that goes for everybody. And so I can't profess to know anybody's finite details and what's important to them and what their experiences are. But I think you're right. Being able to talk about it with respect.
And I think also in being able, going back to flatness, being there in the room, basically, where when a lot of hospitals have evenings or days when people who have had different types of reconstruction will go in and sort of show
Yes.
other patients what it's like. Well, very rare is it that anyone is included who's flat, even through all the work that I've done and loads of other flat advocates have done. It's still
Why do we think that
incredibly
is?
rare. I don't know. I think it's because potentially, and this is where Flat Friends do very good work at trying to influence or not persuade, but to put out all the information they have to breast care nurses, to surgeons. I think that most of them still don't accept it as being what women want. Women want, like we can be lumped together all as one generic group of people.
Yeah.
I think that's what it is. And I think potentially some of the charities who work for reconstruction, which is great, because of course that needs to be talked about and advocated for. I don't know, maybe changing, but I don't think they see aesthetic flat closure as a form of reconstruction, which I think it is.
Do you think it reflects the amount in the NICE guidelines that is based on? So what we know is that if you're looking at, and I don't have it in front of me, but it's the amount of guidelines and guidance relating to aesthetic flat closure is, it's not necessarily proportionate to how much information.
No.
And I agree that it's probably never going to be the same because of the nuances and the complexities that are around, and also the innovations around reconstruction.
Yes,
but there isn't that kind of visual represent, or wasn't. I think in the last decade, certainly in my, I suppose in the last 7 years, I have noticed a change in terms of visibility. But you're a huge part of that.
Yeah, thank you. But do you think that's because you're in that world?
Oh, that's interesting.
And so it's kind of, what do you call it?
I see it.
Yeah.
It's
like when you buy a new car, you suddenly see all of those cars.
Yes.
That's the same with yours.
Possibly. And it would be hard to measure that.
It would, yeah.
Because you're right, we see it and we look for it and it's in our world. I wonder if you are asking someone who wasn't in that space what their views and opinions are on it. Because you're right, there's still not the same level of visibility around
there isn't.
That.
There isn't. I mean, people... Well, it's up to every individual whether they want to advocate or not, and it's hard work and it's difficult, and you do have to put yourself out there. And I did it for a long time, and I don't really do it now because I think I've said all that I can say and want to say in that sphere.
But you are doing, we spoke about this a little bit earlier, you're doing some great work with breast cancer now in terms of those real tangible support functions, peer-based support functions. So I think the advocacy changes shape.
Yeah, I think so.
I remember in the early stages I would blog and I took photos as well. And it was looking back now, I think definitely for me it was a big part of me coming to terms with everything that was happening. Because there were all these crazy thoughts and, busyness and for me to write them and get them out. And then also with an overarching piece to help others. Yeah. Maybe if somebody else sees it and understands, then that's great. But like you, I think it's not linear, is it, that piece?
No, it's not.
I think you can do lots, so you can come back from it and you can do a bit. And it changes shape, the things that you want to do.
Does, yeah. So I do volunteer with breast cancer now. They've got a brilliant service called Someone Like Me, and I just speak to women, usually women, who are going through a similar diagnosis to me or are trying to have a second mastectomy. So that's much more direct, and I don't tell them what to do. I don't advise them. I listen to them and tell them what my experience was and is, and that's a great thing to be able to do, actually.
I hadn't heard of this service. I think it's fantastic. I think it's absolutely fantastic. So you obviously get paired up with somebody and then you have these great informal, kind conversations where somebody can ask you questions.
Ask me anything, Yeah. It can be one phone call or email, or it can be a series. And I've supported one woman for about a year, through all her different stages of treatment. And that's more rare, but... so that's kind of, I still am in that world.
Yeah.
I also do some work with a drug company, I wouldn't say it is, but on some of their campaigns about raising awareness of checking primary breast cancer, but also secondary breast cancer, what to look for. So I am in the sphere still, but not so overtly, I suppose.
Yeah, I hear that. I've loved this conversation.
Good.
We've known each other for a little while in the space anyway, and we've done lots of different advocacy together, largely taking our clothes off and walking down past Parliament, body painted. Right. So, but again,
great.
advocacy for different things. And every time we speak, I feel like I learn more, and you inspire me more. And yes, I'm really grateful for your time. I suppose just to bring this together, start with a difficult question. I'm going to end with a difficult one. If you had one piece of advice to give to somebody who was at the start of their journey, what might that be?
I think I would say take your time. Just take your time in decision making, because and take somebody with you to your appointments. You'll have good days and bad days, and both of those are great, but live each day as if it is a brand new one, but try and be in the present.
Thank you, Juliet.
Thank you, Sam. It's been
Great. Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.